Thanks for joining us. We're just about to start. So yeah, thanks for coming, everyone. And this, I don't know what the weather's like in your place, but it's a nice afternoon here. My name is Cully. There'll be lots of people will know that, but maybe some people won't. I'm an artist based in Dundee, and I'm one of the directors of a charity called Morphe Arts, and that's pronounced Morphe, Heather, just so you know. But I'm also one of the people behind Nomads Projects, along with Owen Daly. Owen will give us a wave there. And Owen is also an artist, and I was going to say, well, he is a tutor at Dundee College, but he also works at St Andrews University on a project there at the moment as well. For those that don't know about Nomas, it consists of 5 office windows. It's based in a street in Dundee called Ward Road. And we use that space to display artworks. The name derives from a Greek word meaning roaming in search of pasture. So it's kind of from the nomadic root. And apart from it being suitably pretentious, we like that that value of, you know, Owen and I, you know, as artists, but also humans who are kind of constantly looking for inspiration. And so that's really the name of it. We have been situated in the windows for a long time, but we, like a number of years, maybe 9?
10 years, Cully.
10 years, wow.
Just hit 10 years.
I was a young man when we started this project. So we have been there, but we thought it might, we thought we might move on. And there have been other projects that we've done in other locations as well. But our aim really has been, to be involved in the arts community in Dundee, to offer or to investigate the role of art in society. That was really important for us, to engage with ideas, to learn from the experiences of others, and to be part of a relevant conversation in the arts in the city of Dundee and beyond. And we're delighted to be working with Shelby Scattergood, who is American-born but currently living in Guardbridge in Fife. I met Shelby at an artist gathering called Transept, which is a group that meet in Dundee. Most are part of the Institute of Theology, Imagination and the Arts in St Andrews, and this group Transept meet once a week to talk about art, to show each other their art as well. And I've been going along to that quite regularly for a number of years. But Shelby had moved recently to Scotland and had joined the group and was showing her work. And I was just immediately intrigued by what she was showing. And so began a series of conversations to try and work out if there'd be an opportunity for her to be able to show at Nomas Projects, not least because I was just really wanting to have a name, Scattergood, on a poster, or because it was just such a good name. No, that's actually not the motivation, just in case anyone was worried about our integrity. So Shelby received a Bachelor of Fine Arts in Drawing and Printmaking from the University of North Carolina, Greensboro, and she's exhibited throughout the United States in galleries such as the Jones Carter Gallery, the Wowsow Museum. Am I saying that right, Shelby? Wowsow?
I think so. Okay, I'm actually not sure how to pronounce it myself.
Of Contemporary Art, 21C in Durham and VA Raleigh. And Nomas are pleased to be giving Shelby her first exhibition in Scotland. So it's great to have her exhibiting with us. Shelby's predominant art form is fine, detailed portrait pencil drawings. But in significant visual contrast, the exhibition post-op that she's showing at Nomas is a selection of pieces that are taken from a larger body of bold, block colour body prints that were made in 2020. And these were completed over the course of 12 months. And it was a series that explored Shelby's first year following bariatric surgery. And I'm sure Shelby will share the details of, just the specifics of what that surgery involves. And our work seeks to spark an honest discourse over the surgery's effectiveness and its ethics. And once I knew that, I thought, yeah, this is a really good fit for NOMAS and the values of the art that we're looking for. So while the visual output in post-op may contrast to her fine pencil drawing technique, the themes and values that she explores around identity really resonate throughout all her work. So I'm going to hand over to Shelby to let her share more about her work and the values and ideas behind it. And there will be time, as always, afterwards for people to ask questions. If you have a question during the course of the talk, you can just put them in the chat and I'll take note of them and we can ask them at the end. We often, as well, can just open up the mics and just ask questions personally as well. If you can turn your microphone to mute, just so there's no background noise, and join me in giving Shelby a very warm welcome. Thank you, Shelby. Over to you.
Thanks, Coley. So let me share my screen real quick. Okay, so so as Coley mentioned, I'm an American-born artist. I'm from North Carolina. My husband and I, Aaron, just moved here back in September. Yeah, September, because he's getting his PhD at University of St. Andrews. And so I'm tagging along and making art while I'm here. So my artwork really started. I'd kind of always been interested in art, but my portraiture specifically really kind of started taking off during undergrad. I don't know how undergrad programs work in the UK, but in the United States, it was a 4-year degree that I did. And I got a bachelor's of fine arts in drawing and printmaking, like Coley said. And so while the project that's on display at NOMAS is these really like intimate kind of like body prints of my stomach, and you can see it on the flyer on the screen right now. The majority of my work is actually hyperrealistic colored pencil portraits. So this is one of the first ones that I ever did. I drew this, I think I was 18, and this is colored pencil on black paper. And this was just kind of the beginnings of me creating the artwork that would later lead into this print series and kind of the current work that I'm making. But my artwork has always had a very deep sense of identity in it. My work has always dealt with my own kind of personal struggles with both physical and mental health. And this portrait specifically, called Blind Faith, was really my first dive into kind of exploring my own identity through my portrait work. And this piece specifically at the time was kind of this attempt to, process this, like, the piece is called Blind Faith, and it was really dealing with that blind sense of faith that you kind of put into the medical system of like kind of trying to figure out, like, especially if you're dealing with chronic illness like I was, really trying to kind of process this idea of like just, kind of taking the meds that you're given and kind of listening to what's being told to you, and kind of just learning to navigate the medical field kind of for the first time in my life, and really wanting to process that through my artwork. And so this piece, Blind Faith, was that kind of initial introduction. And this was also one of the first portraits I ever created. And so this was, I completed this during my freshman year of undergrad. So this was my first intro to portraiture. And then I kind of moved into these two portraits that you see in front of you. And these portraits specifically were made during, I was part of the inaugural program at my university for the Artist in Residence program through the Honors College. And basically what we did throughout this year was we were to create a body of work that we would then present at the end of the year. And at this time, I had just been diagnosed with depression. And so this was my first kind of dealings with mental health. And so I wanted to kind of create artwork that really dealt with that. And so the first piece that I made was called Behind Bars. And that is this piece over here, the one with the black background with the white pencil. I actually drew this in one day. Part of like a weird deadline mishap that I had with a show I wanted to enter it in. But yeah, so not Blind Faith, Behind Bars was kind of this like first attempt to really want to portray like kind of the frustration I felt around mental health, really trying to deal with kind of the struggles of like not only getting a proper diagnosis, but feeling like I was being seen and that my mental health was being taken seriously, and just kind of ultimately feeling kind of trapped behind this diagnosis and this condition that I had. And then with the piece next to it, this was called Brain Fog, and it was willow charcoal on white paper. And this, calling it Brain Fog, really dealt with the kind of just general frustration I felt at like not of my brain just kind of feeling foggy all the time. And really struggling to kind of, navigate that. And so these two pieces really were dealing, I think, just like with the frustration I was feeling at the time. And I think kind of based off some conversations with Coley, I think that is coming through, hopefully, this like almost, I think Coley described it as menacing, but really wanting to portray frustration in this work. And these pieces actually hold a really special place in my heart, because during our during the big like final of year event where we presented all of our work, I presented this, and afterwards, a girl about my age came up to me, and I remember her telling me, she said, your work and seeing you be so honest about, your mental health has really inspired me to want and go and talk to a therapist and talk to my family about kind of my own mental health struggles. And it was just like a really brief little conversation we had, but I just remember that being one of those like major turning points in my art career. That was the first time I think I realized that like art can really spark conversation for people. And it can really kind of act as a catalyst for really incredible things. And so I think that was the moment in my art career where I realized like, oh, this is what I feel like I'm really called to do. Of like, I really feel like I am here to like make work about these things that like I find challenging, like just to kind of visualize them out there. Cause I feel like I'm not very good with words. I very much communicate visually. And so kind of feeling like I had this like ability to communicate these kind of complex things visually, I feel like that conversation with her really pushed me to realize like, this is what I need to do with my work. And so kind of moving on from that, into my senior year. I'm missing two pieces. Into my senior year, I started doing a lot more artwork dealing with mental health. And with these two pieces specifically, these are a bit more subtle. But I had this idea that I wanted to start to create artwork that dealt with emotions. Unfortunately, I don't have any pictures of it, but I did, my senior capstone was I created a self-portrait every single day, and organized them based off of my emotional state when I made them. And it was really fascinating, but part of that project was I made 5 larger pieces, and these were 2 of those 5 pieces. And I started doing this kind of like interesting projection work where I tried to present different emotional states through projection. And they were just like this like neat little like experimental phase I went through. But yeah, so the one, I can't remember if I actually titled this one, the one that's white pencil on black paper. I think it's like projector face number 1. There were 3 of them that I think were named that. And then the purple one on the right is ultraviolet. And these were just like neat little kind of trying to like move into more emotionally driven artwork. And so these really led into my final capstone project called Battered. And this is colored pencil. And this was me really trying to kind of depict depression through artwork. And so for me, how I kind of did that was the model was my sister, and I covered her in flour and chocolate cake batter. So if Chloe's watching, I'm sorry that you had to go through that. But for me, I really wanted to show the kind of like sticky and messiness that kind of comes with depression and a lot of mental health conditions. At least like for me, I felt like this was kind of how my depression felt at the time, was this like just sticky kind of mess that falls down. And I feel like you try to kind of wipe it away and deal with it. And like, it kind of just ended up making more of a mess because I just didn't really understand myself or my mental health at this time. And so Battered was really like my first attempt to kind of deal with that. And I think was kind of the first time where I made a piece and I was like, oh, I feel like this actually kind of works and like depicts what I want it to depict. But Battered is a piece that I'm really proud of. I'm trying to remember how big it is. Unfortunately, the screen doesn't really like show size very well, but it's like this tall and about maybe that wide.
Are they all that size, Shelby? I was going to ask that. Like, what's the size? They're all similar. They're all similar kind of composition, but are they all different sizes? Like, the one that you did in a day, for instance, is that like A3 size or A2? Is it?
They're all about. I'm trying to remember what the A sizes are. I actually just got introduced to the A size paper a little while ago. So I'm trying to remember. It's, I think it's A3. No, A2. I think it's A2. Yeah. Yeah. So they're all about A2 size.
So that's quite large. Yeah.
Yeah. Yeah. This actually, took me one whole semester to complete just this one piece. So it was, it was quite a labor intensive piece. And I would say this was probably the last piece I did that was entirely kind of photorealistic. I really love photorealism, and I think it's something that I navigate towards. But I think after this piece, I kind of realized that I wanted to start incorporating more mixed media into my work. And also just the time of creating larger scale photorealistic stuff just became a lot. And so I started to navigate more towards these kind of mixed media pieces. So following Battered, I graduated from college, moved from North Carolina up to Virginia. And these pieces are, the one on the left is called Control. The one on the right is called Eat, You'll Feel Better. And these were the start of me starting to incorporate kind of realism and abstraction into one piece. And these pieces specifically dealt with eating disorders. And so with these pieces, I really wanted to try and kind of show the way in which eating disorders are kind of hidden in plain sight oftentimes. So the sweaters on these pieces are actually both made out of food packaging. So the one on the left with, there we go. The one on the left called Control, if you look at the kind of textile pattern on the sweater, that's actually made out of barcodes from food packaging that I had cut up to kind of mimic the weaving of something that had been like knitted or crocheted. And the one on the right with Control, all of that silver metallic is actually hand punch sequins that I made out of soda cans. And that's actually like both of these are actually themes that I have continued to carry into my work of using food packaging in these kind of like hidden ways. But I just think that the materials were so beautiful. But sorry, my cat just decided to show up. And so for these two pieces, I really liked this idea of trying to be a little bit more sneaky with like what I was trying to say. And, in making the work, like using materials that were that weren't as obvious as to what they were. And then also starting to incorporate kind of a little bit more abstraction into the piece. Yeah, and both of these pieces are, the portraits are all colored pencil. The backgrounds are colored pencil. The arms in this one are colored pencil, but the arms in this one in Eat, You'll Feel Better are painted. And both of these pieces are actually multiple layers of paper glued together so that I could get kind of the effects I wanted. So like specifically with Eat, You'll Feel Better, the sequins and the paint for the arms are on one sheet of paper. And then the portrait and the background are on another. And the two were sandwiched together so that I could kind of get the really clean lines that I wanted. But yeah, so then leading from these pieces is into, this is kind of the last portrait I'm showing. But this was the last portrait that I did of myself before getting the bariatric surgery that will lead us into the piece that I'm displaying at NOMOS. And so this piece was called This Doesn't Change Anything. And this was about the time that I discovered that I was going to have to get bariatric surgery after having gone through, years of therapy and eating disorder treatment. And, this kind of is a good segue into kind of the bariatric surgery topic for the body prints. But for those that are not familiar, bariatric surgery is, there are various forms of it, but at its core, it is an operation that is done to cause rapid weight loss on a patient. And the specific surgery that I got was called gastric sleeve, which is an operation where they go in and they remove 80% of your stomach. And in doing that, it causes very rapid weight loss. And the reason that I had to get this surgery was I actually had a rare reaction to medication I was on that caused me to go into acute liver failure. And basically it caused, this medication that I was on caused my liver to absorb fat like crazy. And I actually developed something called non-alcoholic steatohepatitis as a result, which is a fancy way of saying that my liver got really, really fatty and I ended up developing scar tissue in my liver. Going through that process, we discovered that, or at least I was told that there was no medication that was available to treat this condition. And my hepatologist, my liver specialist, told me that the only real treatment option was to lose weight or was to lose weight very rapidly, because the thinking and the evidence showed that if you lose, I can't remember what the percentage was, but losing a significant amount of weight very rapidly basically hits a reset button on the liver and can cause the liver to shed whatever excess fat is in it and kind of help it heal itself. And so this was the option that my medical team decided was the best for me, was to go through this bariatric operation. And I went into it kind of with a neutral mentality of, I had been through eating disorder treatment. I had gotten to a point in my life where I was I'm very happy with myself and I didn't really feel the need to lose weight, but realizing okay, I got to do this or I lose my liver. And so as I started the process, I really wanted to record this for myself. I really wanted to make a series of work about this whole process because I knew it was going to be challenging going into it. And I knew that societal attitudes about bariatric surgery can get very complex, especially in the United States. And so I just wanted to give an honest kind of real portrayal of what this surgery is and kind of what it does to someone. And so this portrait that I'm showing, This Doesn't Change Anything, is the last portrait that I made for myself before undergoing the surgery, as kind of just a recording of where I was and just how I saw myself at that time, as just very confident, very, just wanting to show me for myself and for others. And so that then led into the print series, which each of these prints, and I just realized I don't actually have the print of right when I got my surgery. But each of these prints I took 1 month to the day after my surgery. So there was one, and actually it's the one on the poster for the show, is the one I took. I think I took it 3 days after surgery when I was pretty sure I could paint my stomach and not hurt myself. But then all the rest of these have been taken 1 month, 2 month, 3 month, all the way up to 1 year. And the reason I chose to do 1 year specifically is the first year of bariatric surgery, because it takes a long time to recover from this kind of an operation. And the first year is usually the most tenuous, when like the most kind of change and everything is going on. And so I really wanted to record this. And going through the surgery was very interesting, because I think going into it as from a very neutral, trying to go into it from a neutral standpoint, I think I saw a lot about it that I think really kind of changed my view of bariatric surgery. Because initially I'd kind of thought like, oh, on paper, bariatric surgery seems to make sense. Like you go in, you get a surgery, you lose weight, and then ta-da. But going through the process made me realize that this is a far more complicated operation, and the mental impacts and societal impacts of this kind of surgery are very loaded. And I think I really started to see this even just in the pre-op stage. So the way that bariatric surgery works in the United States, and I'm not sure how it works here, but in the States, to get your insurance to cover the surgery, you usually have to go through upwards of between 6 months and a year of prep work. So that means that you go in, and every month I think for me, I had to do 6 months of nutrition classes. So every month I went in for a nutrition class. You have to go and have like all kinds of tests done on your body, like barium swallows, all kinds like chest x-rays, all this crazy stuff. And then, on top of that, you have to like go to these special interest meetings and everything. But going through all of this was kind of the first time that I started to realize kind of the general complications of the surgery. And one of the most prolific, I think, was during these like nutrition classes. And going in, and I remember at one of the first ones, they asked us like, why are you getting this surgery? And, me and I think one other person said, we have some kind of medical thing going on that necessitates us getting this. But basically everyone else said, I'm just opting to do this because I want to look better, or because like, I just want to lose a little weight. And I just remember thinking like how kind of extreme that seemed, to want to go through this, just for the sake of, looking better, or just, yeah, it just seemed kind of extreme. But I thought, and I think the view also, but I think for me, the view was also, whatever you want to do, go for it. But yeah, and so going through this process, I think started to make me kind of nervous. And leading up to the surgery, I remember having a really hard time with it. And then the surgery came, and overall everything went really well. I did have some complications. I ended up developing GERD as a result of the surgery. And the recovery process was really, really rough. But kind of what I noticed in the recovery process was it kind of felt like my humanity got taken from me in a sense. Because whenever I would go to these appointments, my post-op appointments, there was very much this feeling of I wasn't really a person. I was just kind of another number on their like list of successes, basically, that I was experiencing. Like it was always, you walk in and they'd say, oh, how much weight have you lost? And, you tell them and you go through all this, but there was no checking up of mental health. There was no like, how do you feel? Like, well, I mean, like, how do you feel like holistically and everything? It was more just like, are you having any severe complications? Are you losing weight? Great, go home. And so I think, and sorry, I'm a little nervous. So I'm like, I think I might be skipping over things. But yeah, it's just, I think for me, this was like going through this whole process really made me question kind of like, is this surgery really a moralistic or ethical thing to do? And I think, it's difficult, and I don't know that I necessarily have an answer, but yeah, it's because I'm sorry. Sorry, I'm really nervous and I'm just kind of like freaking out.
It's fine, Shelby.
No, I just find myself like mixing over my words. But yeah, so I think going through all of this made me start to question kind of, is bariatric surgery, an ethical thing to do? And I don't really have a question. I don't really have an answer to it. But for me, I think what has led us to bariatric surgery in a way I think it's wise to start to bring up ethical questions about this. Sorry. Yeah, I'm sorry. Yeah.
Shelby, can I just ask a question at the moment? Like, so
yeah.
you'd mentioned earlier about the piece that your sister was the model for with the chocolate, and I can't remember what that one was called.
Battered, yeah.
Battered, yeah. And how you felt like, you thought, yeah, this really captures what I'm trying to put across about what I feel about depression. Mm-hmm. And obviously, when people look at any picture or listen to a song, whatever, the artist could have an ideal that they want to portray, but other people come and maybe look at it and get something completely different from it as well. When you come to making these body prints, it'd be interesting to know when people saw the poster or without any knowledge, if they'd be able to work out what it was, because it looks like an abstract, it looks quite like an abstract shape. But my question is, when you make these, once people know that's what it is, I suppose it's like what conversation comes up once people have got a bit more background knowledge, as opposed to just seeing the image and what effect that could give someone. And when you're talking about with this in particular, where there is a real concern for you over the ethics of it, that, because I think I said that in your introduction, and that came from your statement as well, that you want to spark an honest discourse over the surgery's effectiveness and its ethics. And this I don't know if you've had any other opportunities where that could be discussed, so hopefully we will discuss that later today. But so that's my question, have you had opportunity through making this piece for it to, maybe to speak to other people that have had bariatric surgery, or even to speak to surgeons, about it as well? So that's the question.
No, yeah. And thank you. I haven't really had a chance to kind of talk about this. This is kind of this is the first time that I've been able to kind of publicly show this body of work and discuss it. I have an art Instagram where I posted this like every month as I went through and kind of mentioned, like, in the moment, this is what I'm feeling about this. This is kind of how I'm processing through this, and kind of where my stages in recovery were each month. And it would take a long time to go through each individual month. But I think I would really like to be able to have an open discussion, especially with other people who've gone through this, but also with surgeons about this. Because I think the primary issue that I struggled with this surgery was the fact that I didn't feel like the patients that went through this, and especially for myself, I didn't feel like we were ever really given the long-term support that we needed with this surgery. I feel like you go through the work that, the insurance company kind of requires of you, you get the surgery, and then it's all just about numbers, and there's no real regard for the mental health of these patients. And one of the biggest concerns with this is eating disorders are very high in patients after bariatric surgery. Substance abuse disorders become very high. And a lot of this is that for a lot of people who go into getting the surgery, and I know for myself personally, diet culture is very, very rampant in the United States. And there's a lot of pressure on people to fit a certain mold and look a certain way. And that kind of stress just really builds up in people, and it can really tear you down, and it causes, cyclical dieting. And I think the other term is yo-yo dieting. But there's this constant kind of message that is sent to you of, if you do not fit this mold of what is acceptable, then you are somehow like a moral failure, or you are in the wrong somehow, even though bodies exist in all sizes naturally. We've come up with this like mold that people need to fit into. And so that kind of pressure that is on people, it still continues on after the surgery. So even once you've had the surgery, you're still very much incorporated into diet culture. And I know for me, like even having gone through years of treatment for eating disorder recovery, it really pushed me to my limit to get this surgery. And that was, continuing to get therapy and everything through the whole process. Because it just really continues to push this ideal onto you. But like, I remember, for instance, like, I joined several support groups post-op, and there were instances of people just like attacking one another for just wanting to like live their life. Like I remember one instance of a woman in recovery, and she wanted to, I think it was her anniversary, and she just wanted to eat like a scoop of ice cream. And she's like, is this okay? And just getting like attacked by other people in the bariatric community saying that's not okay. Like you're going to throw away all your progress. And you're just going to undo everything that you've worked hard for just over one scoop of ice cream. And it's just this like horrible negativity and kind of like toxic diet mentality that very much gets incorporated into the bariatric community and kind of stays there. And I just feel like there's no real attempt by doctors or by surgeons or people working in the field, at least in the sections of the field that I was in, to try to make the kind of more toxic and dangerous mentalities associated with weight loss to kind of help remove them after surgery. And I feel like, if anything, I feel like there's almost more of that pressure on people following bariatric surgery. Like, because for a lot of people, bariatric surgery is kind of a last-ditch effort to lose weight. And so I feel like there's so much like, if this doesn't work, then, you've squandered your last chance, you failed. And I just feel like, yeah, I'm sorry. I am not doing a super great job at explaining this. But just
yeah, I think you are, Shelby. I think you are doing a really good job. So this was 2020 this year, or you made these over the course of a year from 2020. And obviously the last time you were presenting at Transept, you were showing, a new, work that was more similar to the work you'd made at undergrad. Mm-hmm. So is there anything you want to share about that in terms of how your thinking has developed coming out of this body of work, and into now how you're presenting?
Yeah, I mean, I think with this project specifically, that has kind of bled over into the work that I want to start doing moving forward. I feel like, because like with this piece specifically, it was so specific on what it was dealing with, that I really feel like I kind of want to like branch away from it and start making work that's a little bit more broad, specifically with my portraiture, dealing with kind of mental health as a whole, instead of these, because I think I kind of started broad and then went really narrow, and then now I kind of want to go more broad again. But yeah, I think especially with these pieces, especially with these pieces, one thing that I really admired about them was they are so quick, but at the same time, with being so quick, they were also extremely personal. And I kind of feel like I want to move towards that I felt like my portraits leading up to this were very labor intensive, took a very long time to create. And in a way, I almost kind of felt not separated from them, but I felt like like I loved all my pieces, but looking back on them, I feel like none of them really quite hit the mark, I think, with where I wanted them to be. But I feel like moving forward, I want to kind of incorporate some of this quick, more intimateness of these pieces into my future portraits, if that makes sense.
Yeah, it'll be interesting to see how that works itself out, because obviously with your portraiture, you were starting to bring other material elements into it, as well as the pencil drawing. You were already starting to do that. Chris had asked just what part of the body it is. He wasn't sure, but just to clarify, so we have answered that it is the stomach. I'll open it up if anyone has any questions for Shelby. Just to say, Shelby, I really appreciate your vulnerability in sharing this, and everything you've shared, even in terms of, talking about depression or mental health, eating disorders. There's a lot of very personal things to share. So really appreciate that. It is interesting when I heard you speaking about your work and how competent, that was what struck me, as when you were speaking at Transit, how competent you were speaking about it. And so, be encouraged by that in the way that you're, talking about something that is obviously really personal and difficult, not least personally, but, just a difficult subject to be sharing. So really appreciate that. So any question, I'll just check the chat, see if there's anything in there. Yeah, Sharon's just also just to reiterate that, thanking you for your vulnerability and honesty. Ben has just left, but just says to pass on his regards and appreciating your talk and your practice as well. So any questions? If you want, just put your hand up, unmute, and you can ask.
I think there was one from Dan.
Sorry, I didn't see that one. Thanks.
That's okay. Yeah, I can read it out loud. Hearing you share, I am reading these images as kind of illustration of the dehumanizing, disembodied focus on stats which you experienced from the healthcare. I wonder, do you consider these portraits, are they disembodied to you, part of you? That's a good question. I actually fully see these as portraits. I think for me, even though they don't necessarily look like portraits, I think, especially since when most people think of portraiture, they think of the face. I think doing these really kind of helped me reevaluate what I view as portraiture. And for me, I think these very much are, because I think they, from a distance, like you can't quite see it, but like when you look up close at these, you can literally see like imprints of my pores. Like in them, you can see like hair and like skin wrinkles and everything. And I think like those are so unique to me, like especially the shape, like, I mean, the shapes of these, like the skin texture, everything is so unique to me that I view them as portraits, personally.
Yeah, that totally makes sense.
Is it okay if I make a comment out loud?
Yes, of course.
Okay, cool. Hi. Hi, Shelby. First of all, I'm echoing everyone who's going like, thank you for sharing so openly. Like, it's been really fun to get to know you through Transept, and I was really looking forward to hearing more about like this particular series that you're showing through NOMA. So I don't know, I'm just like, whoa, thank you. This has been so interesting. I guess I'm thinking more about sharing like a thought about how I've been engaging with your work a bit, because I guess that's just what's come to mind. But so my first experience seeing these particular pieces was when I went to Dundee and I saw them in the windows there. And then I'm seeing, my next step is seeing your artist talk here and seeing all of them laid out on the screen or on the poster. And then hearing you talk about how your own thoughts are so in process about what's the ethical, what are the ethical perspectives on this? And how is this showing your journey? And then even the idea that each one of these is a month apart. I don't know. I guess I'm just really struck by how the way that these pieces are being presented, my own experience seeing them in different configurations or numbers of the series that you've made, and then just your own thoughts being so in process. It's just striking me that, this is such a journey. And I'm so curious to see if you're ever going to be using paint or print ink again, or if the way that you've done this series is going to shape how you do, you kind of mentioned this actually toward the end there, thinking about what portraiture for you looks like going forward and how quick these were versus your labor intensive color portraits. But yeah, I guess I don't really have a question. It's more just that I'm reflecting on how I'm struck by the journey that you've been on in these prints and the way that they tell a story. And it's implied, I think, that the journey doesn't necessarily end at the end of 12 prints or 13 prints, it's ongoing. And so that just kind of struck me. And I guess that's it. It's more of a comment, but I've really enjoyed hearing more about this work from you. So thanks for sharing it with us.
Thanks.
No, thanks. Yeah, I appreciate that.
Any other questions? Even going back to materials, perhaps. Here's one from Sue. Sue Beveridge, it was very powerful to hear you say humanity got taken from me. How did you deal with that? How helpful is your art?
I think for me, my art plays a really huge role in kind of processing these things. I think, and I kind of mentioned it, I feel like I communicate visually. I sometimes have a hard time kind of processing and dealing with language. So for me, visual art is a huge way for me to be able to kind of communicate my feelings and be able to process through things. And I feel like for me, the whole time I was going through this process, all I could think of was oh, I want to make a piece about this. I want to make art about this. I want to put it down on paper and just really express myself through it. And so I feel like for me, art plays a really huge role in allowing me to kind of process through my feelings and allow myself to kind of see how I'm feeling in a moment and be able to look back on it and reassess oh, is that how I still feel now? So it's almost a weird kind of marker to look back on and think oh, I've changed in this way, but also a really important tool in the moment for me to be able to kind of let out what I'm feeling in a way that I think makes the most sense to me.
Thanks, Shelby. There's a question here from Carly. She's asking, what is your model process for other portraits? Obviously, some are you and some are different models. Did you take or use photographs or use a live model?
Yeah, so I use photographs for most of my stuff. When I initially started making portraits, I ended up using my sister as a model most of the time. Just because it was easier. And I think as I was kind of learning how to work from photos, it was a lot easier to be able to kind of manipulate someone else into kind of getting the photo that I wanted for reference. But I think as I have moved forward with my portraits, and especially as I think I'm kind of almost diving more into myself to make more portraits, I think I tend to do a lot more self-portraiture. Well, I mean, taking photos of myself is what I meant. And it used to be that I would draw from photos exactly. I I would come up with an idea in my head and I would think, okay, I have to stage this exactly how I want it for the final piece. But now I've gotten into a habit of just like chunking together multiple photos. So like I'll take a photo of my head and then I'll take a random photo of my arm. Like there's a portrait that I'm working on now where I think it's like a weird mishmash of like 5 or 6 different photos of me that I've kind of like cut apart and put together. And I can't afford Photoshop, so I just use like MS Paint. So the source photos end up looking really bad. But yeah, so I use, at this point, I'm using primarily, I work from photos, and it's usually like a weird collage of multiple photos put together that ultimately ends up leading into a final drawn piece.
I've got a couple of hands raised. I think Chris had his hand up first. Oh, I'm getting all the hands now. Then Cam, then Heather. But just before we come to that, just continuing on very quickly on the. So I'll come back to you, Chris, in a minute. Obviously the body prints specifically have to be personal, whereas with Battered you chose your sister. And the question I've got is about if you choose a different model and it's not you, but it's still dealing with the same subject, does that help to make it more universal in the sense that someone else can relate to it knowing that it's not you, rather than just saying, oh, that's you, this is personal to you, which of course is important, but how do you get from, yes, it's important to me, but actually there's a universality to this? And is that important when you're maybe choosing a model? And then we'll come to Chris.
Yeah. No, yeah, that's a good question. I think for me, I've kind of struggled with this, I guess, a little bit. Because, originally I was using other models to portray my own experiences. And I think through all of my portraits, I have kind of viewed them as a universal experience, but have also tried to recognize, like, you know, I am just like one particular person, like kind of person, with like particular life experiences and everything. So like, I mean, I try, I think, to portray my own experiences through myself, and then, you know, through the portraits of my sister. And there are a few other portraits I didn't show that had other people in them, but they were always trying to portray my own personal experiences. And I think for me, the hope with that was always to portray my own experiences in hope that people could identify with it and say, oh, I experienced that too. But then also realizing that, like, I could it is inherently like specific to me, and that does kind of narrow the kind of universalness of it. So yeah, I do think I have thought about in the future using other models, but specifically if I use another model, wanting to tell their story specifically. And I think right now with my work, I'm still kind of trying to figure my own self out. That, like, I'm just kind of using myself right now. And I kind of have in my head this body of work I want to do that's just self-portraits and just me. But I do feel like after that, I probably will want to move on to just making work about other people and specifically sharing their experiences. And at that point, kind of moving away from sharing my own specific experiences. But yeah, I mean, I do think that there is a level of universalist kind of feel in sharing my own experiences. But I do think that inherently there are ways in which I experience mental health that are very different than how other people experience mental health. So I do think it is still kind of limiting in using myself, but I do think in the future that using other models could definitely help to have a broader reach with kind of the message I'm trying to say. I hope that answered it.
Yeah, no, that's it. That's helpful, Shelby. Just timing wise, just to let you know, it's 5:00. We're hoping to be finished by 5:15. So I've got the 3 hands up, so we'll come to those, and then there's 2 questions in the chat, and then I'm going to hand over to Owen to finish for us. So Chris, over to you. Thanks for your patience. Hi, Chris.
Yeah. What I do is how do I portray in art my stroke. And thanks, Shelby, because it's quite difficult to draw on the depths of yourself and then express it. But you can express things in the language of art that you can't express in words. And the two inspirations for me are Paula Rego, who talks about depression and putting her depression in the art. And the other inspiration is Frida Kahlo about disability and how she goes again and again draw on her own body.
Mm. Yeah. And I love Frida's work. Her work is phenomenal. Sorry. I appreciate you mentioning your inspirations. Thank you.
Thanks, Chris. Chris is also shown with Nomas last year as well.
Oh, cool.
And so obviously articulated a lot of what he's saying visually, which was great. So thanks for that, Chris. I'm going to come to Karen next, or Carly. I'm not sure who's wanting to say, but Karen, hiya. Thanks, Karen.
Thanks. Shelby, again, you have quite a fan club here. I was really struck when you said, I love all my pieces. And I think you were talking about your different art pieces, your different portraits in these. But I had to look up your Instagram account and the account that you posted soon after your surgery. And you mentioned in it, the problem is we force fat people to live their entire lives in a state of apology and shame and leave them with no other option but to remove their stomachs in desperate attempts to escape the shaming. And that gets to the response that you noticed by a lot of others in the sessions that you had. And when I heard you say, I love all my pieces, I'm looking at these prints and you're talking about, you'll do portraits of your arms. And I just really wanted to draw your attention to the beauty of that statement, not just your artwork, but all the pieces of you. And I wonder if you've thought about sharing this, and maybe you already have, with groups where people who feel shamed or whatever, or don't love themselves might hear this. I know it's kind of come up, I think, in some of these questions, but I wonder if you've thought about places where there are people who really need to see this and hear this from you. I was just curious if you had a thought about that.
No, yeah, I would love to be able to share this with other groups. I think I would love that. I'm not sure, I guess, how to go about finding the groups to share this with, but I would very much like to, because I think going through the surgery, I did feel very alone and very isolated, especially in the idea of thinking that this surgery and that also feeling positive about being in a fat body. Like I very much felt like in the minority of that. And so I think being able to be around other people and to see someone speaking about these topics, I think would have been very helpful for me then. And I would love to be able to talk to other people and to share this work with other people who are going through that or having similar kind of struggles with it.
Yeah, thanks, Shelby. I think hopefully this could be a stepping stone for other opportunities, not least if this talk's recorded and you could maybe present it or send it to other people. Alina, that's here, was from Ukraine, or is from Ukraine, and we showed her work, and there's been opportunities that have come from the exhibition at NOMAS into giving her more opportunities to share similar work. So hopefully that could be the case, and maybe people on this call would know maybe and could get in touch with you privately. Heather, your hand's up.
Yeah, so Heather, and I really so moved by your presentation, Shelby, and how I resonate a lot with it. It's funny because at the beginning I showed you a piece of work that I did when I was 18, but I was at that time I was suffering from, I didn't know it was depression. There wasn't a lot of talk about mental health, but I was put on medication. I was told I was manic depressive. And so for me at that time, I used to just draw lots of, lonely people in cafes. That's what I do. Sick. And I think it's that. And so I'm going to quickly, because I've got so much, I really want to keep in touch. I want to speak to you. I'm an art psychotherapist now. And so I do know a lot of people that have been waiting for gush bands, people that have had them. And what I noticed about your work, that the fact it was very controlled before and very meticulous, and how completely raw these are, that it's like everything's stripped away and it's your contact, it's skin on skin, isn't it? Skin onto canvas paper. And so you've stripped everything away. And so it's not surprising that through talking about, because it's that's part of the processing. It's all, going on this journey. And it did remind me of like thumbprints, because you talked about identity as well. And there was just so much in it. And it's interesting because my sister is also a CBT therapist, a part of a team that get around people with eating disorders. And as an art psychotherapist, it's advised that you don't work with people, do art therapy with people with, that are going, struggling with these challenges because of the support that's needed. Needs to be holistic. And I think that's what you're kind of questioning and addressing. And so it's very powerful, it's very needed. And, it's given me, a lot of insight. So it would be good to stay in touch.
Thanks for sharing that, Heather. Shelby, could you put your next screen on? Because I think you've got your details on that, don't you? And if anyone wants to, there we go. If anyone wants to contact Shelby, Heather, if you want to, you could take those details down. Last two questions, and then I'm going to hand over to Owen. So this is from Cheryl. She's saying, apologies if I missed you explaining this, Shelby, but has the series concluded or is it ongoing? And if ongoing, do you see it continuing in a new way beyond these stomach prints?
Yeah, so this particular series has ended. I decided after 1 year I would stop making them. I do kind of wish that I had continued it for another year. But yeah, for now, this particular series has ended. But I have really enjoyed it. And I really enjoyed recording moments through body prints. And I know at some point I would love to do another series kind of like this. I don't know what exactly it would be about, but I would love to be able to do something like this again in the future. And I think I definitely will. But this particular one has ended.
Thanks, Shelby. Last question to Sharon. I'm interested in the connect between your practice and art therapy. It seems to me that the process is therapy, but the product becomes something that also engages with others about the wider issues around how the health system does not always honour the patient. Is that how you see that?
No, yeah, I think so. I think for me, like the process of creating my art has been very therapeutic. And I definitely view it as a form of therapy. I haven't done like art therapy specifically, but a lot of my work has been done while I've also been in therapy. So it kind of like, because most of the time I do make the work I'm doing very public to my, like, make it known to my therapist. So like, I guess it kind of does become art therapy in a way, but the work is very therapeutic for me. But I do do find the end product very interesting in that it is kind of this encapsulation of like that phase of my life and kind of like that phase of like how I was processing things at the moment, and also like my own views. Like some of my work, especially like the eating disorder stuff, like I look back on it now and I'm like, it was very on the nose. Like, I don't know that I necessarily agree with that anymore, but like at the time it was very important because it was very important for me to make it the way that I made it at that time, because that was, kind of how my brain was working at that time. But yeah, I think the process is very therapeutic. And I think the end product is a really interesting kind of like stamp of my life in that moment.
Yeah. Thank you, Shelby. I'm going to hand over to Owen now. I'm aware that people may have to go, but if you can stay on, Owen, I'll just be taking 5 minutes just to let you know what's coming up. And then we'll look to conclude after that.
Shelby, I just wanted to say thank you so much for sharing so emotionally and so vulnerably and so powerfully. It needs to be said, but it's hard if it's you that's saying it, when you're unpacking so much stuff, and we are privileged to be hearing that and participating in it in a very small way. Certainly we as NOMAS are very privileged that you would take that risk and be willing to do that with us. For me, art was always a way of trying to make sense of life, of orientating in the middle of the experiences from my teenage years, and a way to try and work out what was going on. It was a way of processing a lot of these things. For those of us who are joining from different cities, I've wanted to just give shots of Shelby's show in context. So the street level view as you would see it if you were walking past. Now, when we see that there, compared to the sensitive, full-colour, photorealistic portraits, the formal contrast couldn't be more apparent. It is brutal. Here's a lady who does these delicate portraits and fully polychromatic, and then you have this brutal full stop or question mark or exclamation mark through personal experience. And I can't walk past these and not stop when I see the patches, the medical patches on one of the prints. I had surgery in 2009, never been quite right since. And the mental health impact of that and the stress impact is profound, and it's very hard to talk about. But when I see your work, it's so kind of, in one way it's very closed because it's so stark. And that's a good thing because it's so private. And yet you go up close and you see your skin, and then you suddenly realize this is somebody who has been through something significant. What's even more poignant in my experience, or my view, is the fact that it's a byproduct of medicine, that you had to do this. When I think of your first beautiful early drawing with a tablet in your mouth, the blind faith, and then you having to go through extreme procedure as a byproduct of surgery or of medicine. Here's the kind of view as you would see it, just straight on. Cully risks his life every time he takes these because there's buses going past. And so if he comes roadkill, it'll be an interesting show. I don't know how we present him. Sorry, Cully. And here are some views up close in the patches. Like I said, I can't not go past that without feeling quite emotional. So thank you for sharing, Shelby. Can I read? Forgive me. I wanted to read this book. I think he's actually probably a Scottish author. My wife got me this book. And he's talking about the lost art of convalescence. But the extraordinary success of scientific medicine risks divorcing the body from ideas of the environment that nourishes us, that we are animals, part of life. Caught between growth and entropy was something beautifully explored by Thomas Mann in his great novel of convalescence, The Magic Mountain, which sees its hero lying in a sanatorium high in the Alps, considering the nature of illness and recovery. What then was life? It was the existence of the actually impossible to exist, of a half-sweet, half-painful balancing, or scarcely balancing in this restricted and feverish process of decay and renewal upon the point of existence. It was not matter, and it was not spirit, but something between the two, a phenomenon conveyed by matter, like the rainbow on the waterfall, and like the flame. And it goes on, the author goes on a little bit. But this attitude to recovery has been crowded out in modern medicine because it takes time. Sweet wrote another book called Slow Medicine to emphasize how, in the race to cut inpatient hospital time, and by extension in her US context, save money and expand profits, any emphasis on the value of slow recovery has been discarded. Sweet wouldn't want to return to medieval medicine and wouldn't give up her blood tests and scans or robotic surgery or antibiotics, but she would like to see the value of time restored to the practice of medicine. And so would I. And the author's a GP. And it's a very powerful book looking at the notion of how do we recover. And it quotes an art book where they say, think of when you're expected to die and count your days, not from the day of birth, but from the day of death, so that we make our work and kind of keep focused on it. And I love the fact that we have a hand in writing part of our own story and our own recovery. And those prints are part of that, as many people have alluded to. It's not finished yet. Your story is not finished. I don't know how you reconcile the stark harshness of the black and white and the delicacy of these coloured pencil portraits. But we all want to see how this is going to come forward, believe us, when we say that. And here's John Bellamy, an alcoholic Scottish painter, now sadly deceased. But he went through liver surgery as a result of his alcoholism. And the paintings are very, very visceral, as you can see. And particularly his etching, you don't see the human. That left-hand etching, you hardly see the human being. And his paintings are very visceral, as are your prints. And you've gone one further than him. It's not illustrating it. It's straight from yourself. And we are very grateful that you should do that with us. Here's some quotes from when we were showing work from Ukraine earlier. And I wanted to just share this again. The art object, I'll need to move my screen very slightly, bear with me. The art object can embody hurt, hate, and love. The work of art offers the possibility to come to terms with grief, shame, and fear. It can acknowledge and accept excess. And art allows people both to rediscover community and to find a grave for the irreconcilable. And of course, in Alina's context, it was very different, but I thought it was still resonant. The poetry is in the pity, both in Shelby's prints and in the Persian prints that we're Persian drawings we're going to be showing shortly. So I hope that makes a little bit of sense, and we're very grateful to you for joining us today at NOMAS. And we have a very simple website, and we've got sharing.hoarding.org as well. But we would love you to join our mailing list if you're new to our talks. And we hope that you would get in touch with us, put your details into the chat privately if you want. And thanks again to Shelby for sharing today such a powerful story.